Hey, this is Clint at melanomaroadtripusa.com. I'm very lucky to be sitting right next to on the couch here with Dr. Rogerio from Penn State University, and I'd just like to say thank you to him for offering his time up to talk with us today. Dr. Rogerio, what do you do at Penn State University? I know you've got multiple titles, but we'll let you tell them.
Well, I'm telling you because you asked me to, but I'm an associate professor of surgery, pharmacology, dermatology, and oncology. And I'm the deputy director for the Melanoma Center.
Okay, great. And we've spent most of today down at Penn State University looking through their melanoma facilities. And their first class, we spent some time this morning, myself and Jay, speaking to their colleagues down at the Penn State University and really finding out what we can take back to Australia. And they've got some really good ideas of what we can take back. So, Dr. Rogerio, how do we do that? If there's new treatments that are out there, how do we get them back to Australia?
Well, I think that this visit was so important, and I request them to come over because Clinton and Jay, they are survivors, and they know exactly what they are talking when they are talking about melanoma. This was important for us researchers, for the med students that were listening to them, because we are here because of them, and it was really motivating, and would be able to show what we are doing here at the Penn State Hershey Melanoma Center, pretty much trying to find new compounds that can attack and kill melanoma cells. We are trying to translate from the basic science to the patients that we face every day in our clinics, in the operating rooms, and the setting up that we perform here at Penn State University allows that. We have our clinic, our labs, everything in the same building, and this translation makes a lot more easier. And with Clinton's and Jay's visit, I think we open new doors. We open opportunities to increase awareness. We had ideas to creating new task forces for a lot of things that we want to do for melanoma, and at this point they are scattered. So instead of having forces all over the world, we try to join them and make one single strong voice in trying to fight melanoma. And I think this was a great opportunity. Thank you very much for coming over.
That's okay. Yeah, I mean, what we found today is being able to pool resources is going to be the best way in finding a real benefit to people living with melanoma. And Dr. Rogerio, is there, what is the word out there in the research field? Are we getting close to finding something that's really going to help people living with end-stage melanoma, aggressive melanoma?
I think we are getting some good news. In the past year, yes, we have new drugs that's coming to the pipeline that seems to be effective for melanoma. We spent like the last 30 years just waiting for something like that. The last 30 years we didn't have that much to offer. But now, yes, we are having, and all the laboratories are working hard in order to bring new compounds, new drugs, make the drugs that I already have better. And hopefully, in the near future, we will have more things to offer to our patients. One thing that it's nice, I think we never had that many clinical trials as we had before. So this is another thing that we can offer to our patients. Something that is new, because again, things that we had to offer were there for pretty much 30 years. Yeah. So we prefer to offer the clinical trials as much as we can, because the other drugs, we already knew that they would be able just to reach 20% of the patients. That's right. So, and we have much more alternatives right now to offer to these patients, and that's why it's exciting, at least for a couple, 2 years.
And we really felt that excitement at the Hershey Melanoma Research Centre today. And we'd just like to thank Dr. Rogerio and everyone, all his colleagues at the Melanoma Research Centre that made us feel so welcome today. Me and Jay got a lot out of it, and we're going to be able to take a lot out of it back to Australia. And if you come up with any new treatments, we know that we're going to hear about it first from you guys. So.
Oh, absolutely, and that's the whole idea. We want to bring new treatments together, and this is something that we're going to share, no doubt about it. And again, people like you, like Jay, are so important for us to keep doing what we do. And we'll just have to thank you.
Okay, thank you very much.
Thank you.
MelanomaRoadTripUSA.com